Good afternoon, and thank you for joining us today. Because of technical difficulties with the satellite feed due to the wind, Governor Wolf will not be able to join us for the press conference today. I'd like to give you the latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 1,989 new cases of COVID-19. This brings our statewide total to 18,228 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Approximately 850 of the total cases are in healthcare workers. 1,058 of our total cases are in long-term care or personal care facilities, and those number 168 now. Tragically, we have had now 338 deaths among those who have tested positive for COVID-19, and to date, all of those patients are adults. As of noon today, hospitals are reporting that approximately 2,033 patients are currently hospitalized due to COVID-19 in Pennsylvania. This is approximately 11% of our total case count. 600 of those that are hospitalized require the use of ventilators or breathing machines. Across our health system, approximately 45% of hospital beds, 37% of ICU beds, and nearly 70% of our ventilators are still available. We are all looking for a sense of safety and security during these very challenging and uncertain times. There is so much about COVID-19 that we are still learning because this is a novel coronavirus, and it's the first time this virus has been introduced in the world. As we learn more, we are working to keep our children, our family, our friends, and our neighbors safe. Throughout this pandemic, our best protection has been and continues to be social distancing and staying home. Closing schools and businesses is a hard decision. It's hard for our kids not to be in school. It's hard for most of us not to be at work. And it's hard for Pennsylvanians who work in essential, life-sustaining businesses and in health care, who are making sure that we will be able to return to our normal way of life. But it's the right thing to do to save lives. So thank you, Governor Wolf, for taking these steps to protect us. And thank you to Pennsylvanians who are proving that together we can get through this. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Cover coughs and sneezes with your elbow, not with your hands. And try not to touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come in contact with others. These everyday prevention measures can help slow the spread of this dangerous virus, COVID-19, and give hope to our families, in our communities, in our Commonwealth, that we can and we will recover together. If you have questions about your health, please contact your health care provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2787. 1-855-284-2494. Or again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Secretary, from CNHI, can you provide an update regarding whether the Department of Health will begin providing county officials with more information about where coronavirus cases are in their counties?
Yes, so we will be providing to county emergency management officials more information about cases of coronavirus, COVID-19, in their counties, and we're working on doing that hopefully by the end of the week.
Secretary, from several outlets, the New York Times, the Scranton Times, and the Morning Call, questions about the increase in number of cases, of what's driving that uptake, and what do you think that statistic means of the increase for 16 days in a row?
Well, it means that we have widespread community transmission of COVID-19 in Pennsylvania. We are seeing increases particularly in southeastern Pennsylvania, Philadelphia, the suburban collar counties of Philadelphia, and in the Northeast, particularly in Lehigh County and Luzerne County and Monroe County. So COVID-19 is still being widespread in that area, and people are being infected through community spread, and that highlights the significant importance of the mitigation factors that the governor has ordered. The closure of schools, now the closure of schools and throughout the school year. Of course, online schooling would still continue. The closure of non-essential, non-life-sustaining businesses, and the stay-at-home orders. The best way that you can protect yourself, your family, and your community is please stay home.
Secretary, from the Times News, if a life-sustaining business like a grocery store has an employee who is positive for COVID-19, are they under any obligation to tell their customers?
It would be very hard to tell customers because they don't keep track, of course, of who comes in and comes out. But there are specific rules in terms of people who have had close contact, other employees, etc., who have had close contact. And then there are cleaning recommendations for businesses.
Secretary, from ABC 27, today the Hospital Association of Pennsylvania said hospitals are losing as much as $2 billion a month during the pandemic. They're asking for tax forgiveness and a fund to help offset the losses. Are you aware of the problem, and what guidance could you offer?
So we are aware that COVID-19 has put a significant strain on almost all businesses in the Commonwealth, including hospitals and health systems. And we very much appreciate all of the collaboration that we have received from hospitals, health systems, and the Hospital Association. We are aware of those losses, and so we'll be looking for resources to help. And, of course, there will be federal resources coming to help as well.
Secretary, from WNEP, a question about the home health care field. They have a viewer who reports that they work in the home health care field, and they're starting to see an influx of requests from hospitals to take over the care of COVID-19 patients being discharged to home. What are the plans in place to ensure that home health has the same access to PPE that hospitals and nursing homes do? So
it is very important for patients with COVID-19 who have been in the hospital and then are well enough to go home, If they stay in the hospital, then it makes it impossible to admit more patients because the hospital will be full. And so for any home health care worker, direct care worker that is working with a patient with COVID-19, we need to make sure that they have the adequate personal protective equipment and they know how to use it. So we will be working with the healthcare associations to make sure that that happens.
From WGAL, the cases continue to rise in the state. Is social distancing working? And if it is it working? And if it isn't, what can be done?
So social distancing and the mitigation efforts that the governor has put in place are working. They're working in many places in the country, as has been outlined a number of times by Dr. Fauci and Dr. Birx in their press conferences for the federal government, and they are working in Pennsylvania. We are still seeing increases. We are not out of the woods by any means, but the curve has changed. It has gone for that exponential rise that we had talked about, where it was doubling every number of days, to a somewhat flatter curve, but it's not completely flat. We are still seeing increases in the number of cases of COVID-19, particularly in the southeast and the northeast. So we need to maintain our vigilance. We need to maintain our efforts at social distancing and make sure that we buttress the healthcare system for the potential surge of cases over the next number of weeks.
Secretary, from the Citizens Voice and WJAC, some questions about when we'll be able to return to normal. Once the curve begins to flatten, what signs will you be looking for? And do you envision a gradual reopening, or would there be a more specific date when everything would reopen?
Well, as I said, we don't know what specific date this will be. Dr. Fauci has said that the virus determines the timeline. It's very important for us not to, in a predetermined way, determine the timeline, but to follow the course of the virus and the number of new cases that we're seeing. But it is very important to have hope. There will be a time where we will be able to start to relax the social distancing that has been put in place, to relax some of the business closures and the stay-at-home orders. But it will not be one grand day where we do that in Pennsylvania. That would be extremely dangerous. And it's certainly not going to be one day. It's going to be over time. It'll have to go in a very slow, progressive fashion, perhaps community by community, county by county, watching the situation very carefully for any increases that would require us to reinstitute social distancing. We are making plans about how that might happen in the future, but we need to follow the timeline as the virus determines it.
Secretary, morning call, questions about mass testing sites and temporary medical centers in the Northeast. Are there plans for that right now, and can you give us more information?
Yes. So there are plans for a mass testing site in the Northeast, and there are plans for a field hospital in East Stroudsburg in the Northeast. And so the Department of Health, really led by Director Padfield and PEMA, are working on implementing those at this time.
Secretary, from WTAE, yesterday you described some of the efforts underway to better protect patients in nursing homes. Can you recap those for WTAE?
Sure. So patients in nursing homes, in long-term care living facilities, and including personal care homes, are some of our most vulnerable citizens in Pennsylvania. First of all, seniors are more vulnerable to COVID-19 and to having a severe case of COVID-19. And those with chronic medical conditions, such as chronic heart disease, chronic lung disease, like chronic obstructive pulmonary disease, chronic kidney disease, diabetes, are also more at risk. And so we take that responsibility very seriously. And so we are working with all long-term care living facilities to make sure that they implement all of our guidelines and the guidelines from the federal government. And then we're in contact with them if and when they have a case of COVID-19 about infection control procedures. And we are working with them every day. In addition, we have hired ECRI, a company, to do more infection control and to actually further our reach. Now, that's all virtual in terms of over the phone or over other media, but they can even do virtual tours to make sure that nursing homes have the right infection control procedures in place.
Secretary, from the Press and Journal, several reports are questioning the role of ventilators for COVID-19 patients. One story states that New York City officials have said at least 80% of coronavirus patients who were put on ventilators there ultimately died. What is the Pennsylvania Department of Health stance for their use, and has it changed?
So I've read those articles. As we've been saying, this is a novel coronavirus. This is a new virus that no one has ever seen before, and healthcare providers have never seen before. So, of course, we will need to learn the best way to take care of those patients. Of course, it's only the sickest patients that get put on a ventilator in the first place. And so I have no specific guidelines or recommendations for intensive care physicians, but they'll need to take all of that information and apply it to the care of each individual patient and to individualize that care for their best outcome.
Thank you, Secretary. That is the last question for our briefing today. Our next briefing will be tomorrow. Thank you.